A very warm welcome. My name is Dr. André Steps and we are broadcasting almost live from Asclepion in Jena from the headquarters, and this is a webinar all about the MCL31 Dermablate. Let's start right away with all the items and things we can see in here. So you have the box itself. The laser is equipped with all the legally needed items such as switch on, emergency button. You have a main switch in the back of the device. You have, of course, the arm. The arm is connected to a handpiece, which is a unique feature of this particular device is, as you can see here, those pipes are part of a smoke evacuation system, the so-called TEAM, total evacuation of material of ablated materials. There are 3 filters in the belly of the device. You can switch on and off and change the intensity of this evacuation system by this little knob. Well, in the end of the arm you can see the handpiece in here. Once more, of course, the handpiece is connected to those pipes because all the ablated material is sucked in here, exactly where as well the optics are. You have a cable for the spot detection Y. The handpiece we are using today is the so-called Vario spot, and the Vario spot is equipped with 6 different spot sizes. That means the smallest spot size in here you can see is 1 mm. You can just change when and if turning the wheel up to 6. So that means the spot size changes depending on the lesion you would like to treat. There are basically in erbium 3 different values you have always to have in mind. Of course, the size, so the diameter of your lesion. The second most important thing is the depth of your lesion. So you should be a dermatologist knowing about the pathology of your lesions to be treated. And the third thing is you might need heat or you might not. And therefore there's always this philosophical question, what is better, to ablate human skin or any kind of lesion in human skin in erbium or in CO2? The CO2 always comes with a certain amount of heat, which is absent in this erbium device. But hang on a little moment, we will be touching that thing in a little while, okay? After talking about the box itself and the appearance from the outside, we are going a little bit more into detail. After setting up a proper size of the lesion itself and the channel and the dimension of the ablation, we are in need to set up more parameters, more based and related to the laser itself. That means the device is basically to be managed from up to down, from left to right. What does that mean? First thing, size of your lesion. Then the second most important thing is actually the depth of the ablation you would like to perform. And the depth of the ablation is determined by the fluence. The fluence is joules per centimeter squared, and this is nothing more than the energy of the laser beam being impulsed on the surface of the skin. To all of you not really being sure about what are the pros and the cons of an erbium and a CO2, and always there is this argument about the weak erbium against an CO2. I would like to show you just only one little item, one little part. The maximum fluence of this device connected to that handpiece is 250 joules per centimeter squared. This represents a depth of ablation up to 1.2 millimeters per impulse. That means more than you will ever need. So that means this is more powerful and might be a little bit even more dangerous than you might think. Well, the first line is the ablation we were talking about. That means in good value to start with is about 10 to 20 joules per centimeter squared. This is treatment related, the same as the size of the laser beam. The next thing is the matter of the pulse duration, so how long this laser light is emitted. We can go up to 1000 microseconds. The minimum is just 100. 100 microseconds is considered to be a short pulse, is considered to be cold. Maximum is 300, which comes beyond that is considered to be long and so hot. That means after the treatment related parameters, the pulse is more about the heat, think about hemostasis, and think about pain. So that means whenever you do not apply any lidocaine as a preparation for the treatment, you might need a pulse duration between 100 and 300 microseconds. So, pulse duration is about heat and heat is about pain. Short pulse, less pain. The third row is about the speed. So it's in pulsed laser, and a pulsed laser means there's a repetition rate. The repetition rate in here goes up to 20 hertz, in some other cases up to much more. But in the daily dermatological routine, you don't need even 8 hertz. Why? Because talking about once more about repetition rate and this pulse duration, the heat is represented not only by pulse duration but as well by speed, and much more than pulse duration. That means the more faster you go, the hotter it gets. And being a rookie, starting up with this device, my recommendation is to start with 1 to 4 hertz, which allows you always to control what you do and to maintain a treatment which is literally pain-free. So once more, talking about the parameter range in here, first row is the depth of your hole. Second row is the pulse duration, the, let's say, temperature of your pulse. The longer it gets, the hotter it gets. Third row is the speed, how fast you would like to treat, you can treat. The faster you go, the more experienced you should be, and the faster you go, you should know that the more painful for the patient once you are not using any kind of pain reducer. Well, and there is a fourth line, and this fourth line is not active now. Why? There's only ablation visible here on the screen. Once turning the wheel to a diameter more than 3 mm, you can change between ablation, everything what we were talking about in the last seconds, or therm. Therm represents a mode which is non-ablative. As you know, laser basics are all about what is an erbium all about, what can you do with an erbium, and erbium is considered to perform cold ablation treatments. Cold ablation treatments means you have as a disadvantage in bleeding, but you do not have any kind of pain. Once changing to therm, you don't have no ablation at all anymore. On top of that, you do have no ablation at all. You just have heat, and heat would be able to perform any kind of non-ablative skin tightening. The old question in the ablating business is always, what is the better choice? It's about the CO2, it's about the erbium. The erbium comes up with a wavelength of 2940 nanometers, which perfectly matches with the peak of absorption in water. The CO2 deals with a wavelength of 10,600 nanometers, which is approximately a little bit more than that, but 10 times less absorption in water. Why it's all about water? What we are basically doing here in the absorption is you have little water molecules. Light comes from above, out of the laser, and the water molecules basically are shaking on a molecular level, and exposed to heat, they're shaking a little bit more. And once there is a certain level reached, this shaking becomes that dominant that they are losing their connection, and out of fluid water you are getting gas. So the ablation business is all about vaporizing water. Water which is in here in our skin as in fluid water. The laser heats this water up to a gas. And now we are coming to an idea how to manage that, how to get exactly the point of vaporizing water. So, starting always with the handpiece itself, you are setting up the area, the diameter, the dimension of your ablation. This handpiece, as mentioned before, is able to perform laser beams between 1 up to 6 mm. This is the first really important matter. The second most important question is, how deep is your hole? After setting up the dimension, and the dimension you can see here, different spot sizes, different sizes of the so-called pilot beam. You cannot see that. I can see, that's enough. Well, let's go back to the spot size itself. We are starting up with the most important value, that is the spot size, so the diameter. The diameter you can change easily by turning the wheel on the handpiece between 1 up to 6 mm diameter. So that means, let's start very small with 1 mm. You can see not only the laser change the size, but as well the aiming beam, the so-called pilot beam. Coming then to the user interface itself, first row is about the energy. That means the intensity of the laser. How deep is your ablation? That means the fluence is directly connected to the depth of your ablation. More fluence, deeper hole. More fluence and deeper ablation. The maximum is more than 1 mm per shot, per impulse, and therefore much more that you might be in need for at all. Second line is the time. There are pulses available between 100 up to 1000 microseconds. Always have in mind that the bigger the number, the longer the pulse, the hotter it gets. That means the bigger the number, the more painful it is. So, after mentioning the spot size of the handpiece, we are talking about the depth of your ablation fluence, and both of those values is treatment related. Those following two parameters are more patient related. Why? 100 to 300 microseconds is considered to be cold. 600 to 1000 is considered to be hot because long pulse. Hot pulses are always painful pulses. That means try to have an easy life and an easy patient with 100 to 300 microseconds, which is considered to be short, cold, and pain-free. The same applies to the repetition rate or the speed. The maximum speed in this device with this handpiece is 20 Hertz. Far too fast. You might be able to control up to 8 to 10 Hertz. My recommendation is to start up with 1 to 4 Hertz. Why? Because in this kind of setting you are always maintaining a pain-free treatment. 4 Hertz, 20 Joule, very good setup to start with seborrheic keratosis, for example. Another feature I would like to point out is the feature available with the beginning of 3 mm. You can change between ablation and thermal mode. Ablation is clear, cold, clean ablation. Thermal mode is no ablation at all and only heat. So this erbium yak with the wavelength of 2940 nanometers is able to perform non-ablative treatments. So between non-ablative and cold ablative you can perform almost any kind of treatment you would like to have. That means with the highest absorption in water of this wavelength, you can in a certain way emulate any other laser working on water, such as CO2 as well. So once more, little easy tale. We are talking about little water molecules in the skin. We are applying light onto those water molecules. The water molecules on a molecular level begin to shake. Once they have reached a critical level, they are shaking that much, they are losing the connection with each other and becoming gas. So it's all about water, fluid water becomes gas, and this is performing our ablation. So, and we can decide with this kind of device, shall it be only shaking, non-ablative skin rejuvenation? Shall it be shaking and flying, so in hot evaporation, which would be the same thing like in CO2, or don't we use something like the shaking at first, but just the evaporation? This is cold ablation as you know it from the erbium yak. So, one last little sentence. This device performs treatments between non-ablative treatments, hot ablative treatments, and cold ablative treatments out of one box. How to do that? Stay tuned. Let's get it started. As for the preparation, it's pretty easy, so basics. At first, we will be disinfecting and cleaning the area with a non-alcoholic disinfectant. So you can see what we are treating in here. So any kind of a little fibroma, seborrheic keratosis, or any kind of other elevated benign lesion, we can treat very easily and very precisely. However, we all don't know but the pathologist. So what I do recommend at any time is, if you have any doubt, take a biopsy. So 2 options, just a scratch or a punch. A punch, of course, gives you more an idea what it's all about in a depth, while if you just take a scratch, the information depth is limited. After disinfecting, we can go for an pain prophylaxis if needed. So we will be doing that here, but it's not requested or it's not needed at all. Well, what we can do as a brain prophylaxis is 2% of lidocaine, what we are performing here, as an infiltration. So here we go. Pushing a little bit, pushing a little bit. First, and second. Always have in mind that the lidocaine injection is about 2% of lidocaine and 98% of water. And water is as well our chromophore, what we are working on with the erbium. So that needs a little bit more time to let it go down, this infiltrated area. And after that, we can go for the treatment itself. As for setting up the parameters, it's important to see the size itself of the lesion. Might be you have a 2 millimeter perfectly round shaped, 3 millimeter perfectly round shaped lesion. And said, hey, I do have the same in here. Let's go for the same setup. And you will be failing. Why? Because if you would set up then the 3 mm and just keep it there, don't move and just shoot, you will have a little crater on the outside and a deeper ablation on the inside. Why? Because the water content in the center of the lesion is probably higher than the outside, than the edges. So that's why you will be always setting up 1 mm smaller in diameter, and this is the first step. Up to down, left to right. Next step would be the depth of your ablation. And now, once more, observe the lesion itself. The lesion is approximately 2 millimeters elevated. And that means 2 millimeters we have to ablate. Here in the screen you can find the ablation depth of 1 shot. 40 is pretty okay, but far too less of what we are in need for. In this very case, I would set it up between 40 and 50 joules per centimeter squared. At 2 millimeters, we are always safe, and to play super safe, just only with 1 hertz, because then I can predict, I can anticipate each shot, and once I have a good feeling about that, I can increase the speed. Let's start it like that. Well, The way to treat appropriately is to touch the skin, the surface of the skin with the spacer, as you can see here. Perpendicular alignment would be perfectly matching with an homogeneous ablation, but if you go for 70 degrees or something like this, this is still okay. Let's go for the first impulse. 3, 2, 1. So take a closer look. As you can see, it got a little bit flatter. We applied now 4 impulses. As you can see, of course, the lesion is still present, not yet gone. But we have all the time in the world to move layer by layer and to ablate the entire lesion. Once more, take a look to evaluate, and I will continue with 2 or 3 more shots. And now, after removing, say, 80% of the lesion, I lower down. If you would like to do that, of course you can stop here. I would like to lower down a little bit the fluence, what is reflected by a less deep depth of penetration, and increase a little bit the speed. And now it's time for the finish. Here we go. The treatment itself, as you can see, takes you something like less than 1 minute. The ablation is performed not only until the edge of the epidermis, so the level of the epidermis, no, it doesn't reach only to the epidermis but to the dermis. So you have to catch the root itself. So for any elevated nevi, for example, and compound nevus, you have to reach, of course, the dermis as well. So, and art in doing so is not to reach too deep, but to leave it at a certain point in order to remove the alteration in the skin, but to avoid in scarring afterwards. As for the post-op procedures, you have here a little bit wound healing promotion. You can do a lot of different things. What we put here is a little bit zinc, put some vitamins, but as well any kind of wound promoting ingredient would be. As you can see, it's a pretty amazing and easy job to ablate benign dermatological lesions. What have we done at first? We were preparing everything, we were cleaning, disinfecting with a non-alcoholic disinfectant. Why non-alcoholic? Because it cannot burn. Secondly, we went for a photo documentation, which is super important to document what have we treated, how about the situation before and afterwards, for the patient and for ourselves as well. Later on, we were setting up the spot size, depending on the size of the lesion, always a little step smaller. If we have a 3 or 4 mm in diameter, we went for a 2. Second most important step was to manage the depth of ablation. In this very situation, we went for 40 to 50 joules, representing an ablation depth of approximately 200 micrometers. 200 micrometers is 0.2 millimeters, and so to say 10% of the elevation of the entire lesion. And this is actually what I like most with this device. You can anticipate, you can predict precisely at first, in the very first moment, what will happen with your treatment. That means you can always modify, you can always react on the fly, but you can predict in the very first hand what will happen. So there are no surprises, and this gives you the opportunity to work with an aesthetically precise result out for your patient. The next parameters we were setting up was the pulse duration and the speed. The pulse duration was between 100 and 300. In this very moment we were using 300, which is considered to be short and cold, and so painless. Last but not least, we were setting up this speed to 1 to 4 hertz, which gives you always the chance and the time to interfere. If anything would go wrong, you are not too fast to have an ablation which might be too deep. So 1 to 4 gives the patient a pain-free treatment, and for you all the time to react appropriately and to stop at the very right moment. Hey guys, so let me say thank you for your patience and for your interest. Thanks for watching and listening. Be sure hope that we have inspired you a little. With this treatment of a little fibroma, you can treat a broad variety of so much more. So xanthelasma, syringoma, adenoma, any kind of nevus, epidermal, dermal, compound nevus. We can treat fractional rejuvenation, whitening, everything with this device. Non-ablative tightening we can do. We can go for more surgical applications. So whatever you have in mind, whatever you would like to see, let us know. We are more than happy to provide you the next webinar, the next inspiration to use your erbium at home even more properly. And thanks once more for watching. Take care, bye bye.